Do you need Adderall, but you can't find it anywhere? If you're watching this video, chances are you're one of the many people impacted by the ongoing Adderall shortage in the United States. It's been a frustrating and difficult time for patients with ADHD who rely on Adderall to manage their symptoms. But why exactly is there a shortage of this medication in the first place? Stick around, I've got all the answers. My name is Sulman Aziz Mirza. I'm a psychiatrist who's board certified in adult psychiatry, child and adolescent psychiatry, and addiction medicine. And this shortage is definitely impacting me too. Ugh. Thanks for watching, and make sure to subscribe for the latest developments in news in ADHD and mental health, and make sure to check out some of my other videos on ADHD by clicking the card above. It's no secret that Adderall shortage has caused a lot of frustration and difficulties for patients with ADHD who rely on their medication to manage their symptoms. The shortage has led to a number of problems for patients and prescribers alike. First and foremost, patients have had trouble accessing their medication. Pharmacies have been running out of Adderall or been unable to keep it in stock, leaving patients without their necessary medication for extended periods of time. This can be especially difficult for patients who require Adderall to function in their daily lives, such as students or individuals with demanding jobs. In some cases, patients have had to switch to alternative medications or treatments. This can be a difficult and time-consuming process, as finding the right alternative medication can take time and may require adjustments to dosage or treatment plans. Additionally, the Adderall shortage has led to higher costs for the medication. Some patients have reported having to pay significantly more for their medication due to scarcity and demand, as well as having to change medications to ones that may not be covered by their insurances, which can be a financial burden for those who are already struggling to afford their healthcare and medication costs. For prescribers, the shortage has also been a challenge. Some healthcare providers have reported having to switch patients to alternative medications or adjust dosages to account for the lack of Adderall. This can be a difficult decision, as Adderall may be the most effective treatment option for some patients. It's been a frustrating and difficult time for patients with ADHD who rely on Adderall to manage their symptoms. But what can you do to cope with the shortage and manage your symptoms? One strategy is to communicate with your healthcare provider. If you're having trouble accessing Adderall, talk to your healthcare provider about potential alternative treatments or medications that may be available. Your healthcare provider can also work with you to adjust your treatment plan or your dosage to account for the lack of your normal Adderall dose. Another coping strategy is to prioritize self-care. This can include getting regular exercise, practicing stress management techniques like meditation or deep breathing, and getting enough sleep each night. These strategies can help you manage your symptoms and improve your overall well-being, even if you don't have access to your medication, Adderall. It's also important to stay organized and keep track of your symptoms. Make a list of the symptoms you experience, how often you experience them, and how severe they are. This can help you and your healthcare provider make informed decisions about your treatment plan and adjust it as needed. If you're struggling to afford the cost of Adderall due to scarcity and demand, or alternative options that are presented that may not be covered by your insurance options, there are resources available to help. Some pharmaceutical companies offer patient assistance programs that can provide discounts or potentially free medication to those who are in need. Your healthcare provider or your pharmacy may be able to help you provide more information about these programs. Lastly, it's important to stay informed about the Adderall shortage and potential solutions. Keep an eye on news and updates from healthcare providers, regulators, and pharmaceutical companies. This can help you stay up to date on potential solutions or alternative treatments that may become available. It turns out that there are a few different factors contributing to the shortage. For one, there have been manufacturing delays due to the COVID-19 pandemic. Many pharmaceutical companies have had to adapt their operations to ensure the safety of their workers and comply with social distancing guidelines, which has caused delays in the production and distribution of many medications, including Adderall. In addition to manufacturing delays, there have also been supply chain issues that have impacted the availability of Adderall. This can happen when there are disruptions in the distribution of the medication from the manufacturer to the pharmacy or healthcare provider. It can also occur when there is a shortage of the raw materials that are used to produce the medication. The largest generic manufacturer of Adderall, Teva, was one of these companies that was hit the hardest, which caused a chain reaction to other generic versions running low and then running out. Lastly, there has also been an increased demand for Adderall in recent years, which has put additional strain on the supply of the medication. This may be due to greater awareness of ADHD and more people seeking out treatment for the disorder, due in no small part to the rise of online pill mills like Dun and Cerebral, who have taken advantage of the loosened telehealth prescribing laws for controlled substances. Combined with the DEA setting and controlling the supply of Adderall and putting a cap on the amount available due to the concerns about diversion or misuse, all of these factors have contributed to the ongoing shortage of Adderall in the United States. If you're like many people impacted by the Adderall shortage, you've likely been following the news and keeping an eye out for any updates related to the shortage. While there have been some recent developments that could be potentially beneficial and provide some relief for patients and prescribers. One recent development is the FDA's announcement that it's working with pharmaceutical companies to increase the supply of Adderall and other ADHD medications. The FDA has been working to expedite the review process for new generic versions of the medication, which could help increase supply and alleviate shortages. Another recent development is the announcement of a new generic version of Adderall that could help increase the supply. In December 2022, pharmaceutical company Cipla announced the launch of its generic version of Adderall XR, which is the extended-release version of the medication. This can provide some relief for patients and prescribers who have been struggling to access the medication. It's important to keep in mind that while these developments are positive news, it may take time for the increased supply to make its way to pharmacies and for patients to see the benefits. It's also possible that there may still be some challenges related to supply chain issues or other factors. Wrapping up, the Adderall shortage has been a difficult situation for many patients and prescribers, but recent developments suggest that there may be some relief on the horizon. It's important to stay informed, communicate with your healthcare provider, and prioritize self-care during this time. We hope that this video has provided you with some valuable insights and information about the Adderall shortage. Be sure to stay tuned for our next video, as well as checking out our ever-growing library of them. If you've enjoyed this video, please don't forget to like, comment, share, subscribe, all that fun stuff to stay up to date to what's going on, the latest developments related to the Adderall shortage, and your mental health. Thanks for watching, and we'll see you in the next one.